All right, open enrollment is upon us, and if you're trying to choose a Medicare plan, it can be difficult.
Yes, you want to have great coverage, but also great value. And Marla Pantano, president of Care Partners Connecticut, is joining us now with more information. Thank you for being here.
Thank you for having me.
Well, all right.
Great to see you guys.
Yeah, it's good to see you again, Marla. You know, the first thing, let's start at the beginning. When it happens, what happens when somebody turns 65?
Right. So when you turn 65 and you retire, you have the option to, enter into what's original Medicare,
Okay.
which most people think about, which includes Part A, which is all your hospital-based services, and Part B, where you pay a small premium to the government, and that covers your, your professional services, your physician and other services. It does not cover drugs that you would need to purchase a separate policy for, and several other benefits. In addition to that, if you choose original Medicare, you pay 20% of the cost out of your own pocket, and there's no limit on how much that can be.
Yikes.
So it can be quite costly for folks.
Okay. So basically, you want people to know original Medicare only provides partial coverage.
Right, exactly. But there are ways for you to actually, instead of using traditional Medicare, to go into a Medicare Advantage plan, which is also called Medicare Part C. And if you choose a Medicare Advantage plan, that encompasses all costs. So you can get those at $0 premium, and it will cover everything that original Medicare does. Plus, it also puts a limit on the amount that you have to pay out of your own pocket. For example, at Care Partners, we now are going to have a plan next year that you only have $4,900 out of pocket, so you can't pay any more than that in a year. In addition to that, and it also covers prescription drug, covers hearing aids, exams. You can get dental coverage, et cetera. So it really is a great value and a lot less money out of your own pocket.
All right, dental coverage. I know it's a concern for many, and we don't have great dental coverage even here. It's okay, but what about when you're that certain age?
Right. So again, as I said, Medicare doesn't traditionally cover dental, but you can get Medicare Advantage plans that do include it in the benefit.
Oh, that's great.
Some, like ours, are included in the $0 premium. You don't have to pay any extra. Others, you might have to pay an extra premium for the dental. And it allows you to get, things covered such as your exams, your x-rays, and also helps you pay for many of the other larger expenses, such as bridges, dentures, crowns, et cetera.
So this is the time where you want to research. So how do people find out more information so they can pick the right Medicare Advantage plan?
Right. So there's a few different ways that we can help you. First, you can call us at Care Partners of Connecticut, and we're happy to go through those options with you. And if you do that, the number is 844-388-6589. The other is, if you're not ready to talk individually, that's with a broker or agent, you can also join one of our seminars. We have free seminars where we have, again, a broker that will go through with you, an agent that will go through with you and explain all the different types of Medicare options that I just covered very briefly. And if you'd like to sign up for one of those free seminars, you can go to our website at carepartnersct.com/connect. And we have many of them over the next several weeks. So you can find a time that works for you, and that will give you more information. Or you can also just contact your own local licensed agent or broker. And then if you're comfortable with it, you can go online into some places that have online, such as Medicare.gov.
Marla, is there a deadline, Marla, that people need to get this done by?
Yes. So tomorrow is the first day that you can change plans. Of course, if you're brand new to Medicare, you can do it at any time, but it's tomorrow, the 15th, and then it runs through December 7th. So that's any changes that you want to make to your plan.
Okay. And then what happens on December 7th? It just rolls over if you don't do anything?
That's right. If you're already enrolled in a Medicare plan and you don't make any changes, then more than likely you will roll over in that plan, unless your Medicare Advantage plan contacted you to tell you that you have to take a certain action.
And stupid question, Marla, but let's say I'm 65. Do I automatically get Medicare? It just shows up, or do I have to sign up somewhere?
There is some actions that you have to take with the government, and they will contact you. So yes, you do need to ensure that you select Part B, for example, and that you get enrolled in that.
Okay, very good, because I just thought it came automatically.
You gotta at least make a phone call, maybe. This is why we want to give people more information. And again, I'll give everyone the phone number again. It's 1-844-388-6589. Or if you want to go online, visit carepartnersct.com. Great thing to sit down and even do with your parents. Thank you so much for the good information. Thank you.
Thank you. Take care.
All right, have a great day. Yeah, it's super important. You know, I still have 8 years to go.
Well, and it's good to help your mom because
Absolutely. She knows more than I do.
Changes happen, and you need different doctors.
Right.
And different
She's
things,
all in with the donut hole and the whole 9 yards and this, and you got to figure out the money. And I'm like, what are you talking about?
All right. Those are your Thursday thoughts for today. Eyewitness News at 4 is coming up next.
When the wave arrives at the shore, know how to ride it. You can't tame the sea.
Thanks for watching Channel 3 Eyewitness News. Watch us live wherever you are on our mobile, on our streaming news app. And you can also watch us on Roku, Apple TV, and Fire TV.